Hi, I talk about bronchopulmonary dysplasia. I study nursing school, Technica English. My teacher is Master Yo Moscoso and my name is Carla Espinosa. Definition: it is a chronic lung condition that affects newborn babies who have been on a respirator at birth or were born very prematurely.
Hi, and welcome to Rapid Respiratory Review. Today we're going to talk about BPD, or bronchopulmonary dysplasia. So what's it caused by? It's caused by positive pressure ventilation, endotracheal tube being in too long, and prolonged exposure of differing amounts of FiO2. And it's typically seen in patients with RSV, and it was previously known as chronic lung disease. So what makes you more prone to BPD? If you have a PDA, a patent ductus arteriosus, poor nutrition in utero, family history of asthma, and fluid overload in the first few days of life. So how will it present? You will see radiological changes which go through 4 different stages, and these stages were more common before 1989, before the development of surfactant. Now that there's surfactant, it changes how these patients look on x-ray, so we won't talk about those 4 stages. Clinical presentation, those present with pulmonary hypertension, poor tolerance to feed, tachypnea, retractions, and nasal flaring. If they're less than 2, they may be readmitted with RSV since they're really they have more prone to getting infections since their airways are compromised already and they don't have the ability to exhale or inspire properly. And prevention of BPD would be go as low on your FiO2 as you can just to maintain the same sats, and use low volume ventilation. The treatment, treat with what caused it. So if you're using high modes of ventilation, decrease that as soon as you can. And in other words, like if you were using a CPAP tube, you want to decrease those pressures as fast as you can and get the baby off the ventilator, and if not off the ventilator, change to non-invasive as fast as you can. Thanks for watching. Have a great day.
Application in medicine. Along with asthma and cystic fibrosis, BPD is one of the most common chronic lung diseases in children. According to the National Heart, Lung and Blood Institute, National Institute Heart, Lung and Blood National Institute of Health, National Health Institute in USA are between 5,000 and 10,000 BPD cases a year. Children with extremely low birth weight, less than 1,000 grams or 2 pounds, have a higher risk of developing this disease.
Autumn was actually born at 26 weeks. She weighed 1 pound 6 ounces, and she was on and off the ventilator till now, and she has what they call BPD, which is chronic lung disease.
She literally would turn blue in front of your eyes. One of the things that we do the first day that they come here is we assure them that their child's going to make it. We are going to get them and their child through this.
They have a special unit here for BPD, which drove us here. It's exactly what she has, so we wanted her to get the best care for that. It is a 6-hour trip for us, but we feel right at home.
What the Comprehensive Center for BPD does is changes the way we ventilate these babies, changes the way we care for these babies, and makes it so that they can be comfortable all of the time.
When we came here, within just a few weeks, she was a completely different baby. She is the happiest baby now. She can breathe easy.
Everything we learn here helps children everywhere. We have very smart scientists at the bench learning about these things at a microscopic level, and then we translate that into new and different care practices. We're trying to fundamentally alter the prognosis for this disease. That's our vision. That's why we do this. We want to help every single baby.
We really appreciate everything they've done for us here. We'll be ready to go home when she's probably 11 months old, hopefully before her first birthday.
Patients like Autumn often have to spend months to even a year or more in the hospital. That's time well spent because what it does is lay the foundation for a normal childhood and a normal adulthood. Using the techniques that we've developed here, Autumn actually does very well. She's bright-eyed, she's beautiful, she interacts great with her family. She's a joy.
As a mom, I hope that Autumn learns how to ride a bike and just normal childhood things that everybody wants for their baby.
Pros and cons. As a result of injuries in the lung tissue caused by the fact of being on a ventilator for a considerable amount of time. Respirator allow breathing to those infants whose lungs are too immature to breathe on day one. Respirator also provide the oxygen need lungs of premature babies.
We use oxygen to little tiny babies properly. There are some concern. Can oxygen do any damage to the lung in a baby?
The very high levels of oxygen actually can cause damage to the lung by way of oxygen radicals. That's particularly important for children who are born prematurely and whose lungs are not very well developed.
Is there a name for this particular condition?
That condition is known as bronchopulmonary dysplasia.
Okay, is this permanent damage? Does it get better in time? What?
It tends to get better over time, but if you check the lung function of children born prematurely when they're 30 or 40 years old, then you still can see very subtle defects in airflow obstruction.
And they would act like almost like an asthmatic the first year?
For the first year or two, it's not uncommon for them to actually have a lot of asthma types of exacerbations. Most of these children do get better when they get older, but as I mentioned, even decades after they're born, you can often see very, very subtle defects in their lung function.
Is in Ecuador. BPD can be a serious condition requiring intensive medical care. No child is born with bronchopulmonary dysplasia. This is a disease that develops as a consequence of premature and progressive lung inflammation.
Bronchopulmonary dysplasia, a chronic lung disease in infants who received mechanical respiratory support with high oxygenation in the neonate.
I don't know. Red, blue, black, bronchopulmonary, dysplasia.
Bronchopulmonary dysplasia, or BPD for short. BPD is chronic lung disease of preterm infants, and while we'd ultimately like to prevent prematurity and prevent bronchopulmonary dysplasia, when we have to treat it, we don't always know which medications work best for BPD because the drugs were often developed in adults or older children. And so we're working here to determine which drugs work best for BPD and ultimately develop best practices for the treatment of BPD.
Conclusion. The improvement in the technique of mechanical ventilation and general care of the most immature babies, as well as advantage in parental nutrition, along with the use of oxygenous surfactant, suppose that in the 18th substantial chance occur not in improved survival of premature infants, but in reducing the consequence. Thank you.